questions, email us at info@tonisays.com. If you have something that's really more personal, you may want to make a phone call. Our phone number is 832-519-8664. So let's get started. And this is the Confused About Medicare, and we're going to also talk about Social Security at the end. So if you've got specific questions, to email them, because what you don't know will hurt you. Again, this is the Confused About Medicare workshop, and what you don't know will hurt you. Sometimes you don't understand what's going on and you miss your time to enroll, or what's going to happen, or how to get in the donut hole, or picking a prescription drug plan. And it can affect you not just for today, but for the rest of your Medicare life. So let's get started. I have been doing this for 10 plus years. And how I got started, I went from a book to a mission. And I had a gentleman who came to one of my Medicare workshops, and he got the wrong information from Social Security, which cost him over $10,000. He called Social Security, asked them a question, but did not use the proper wording. And as far as everything going on with COVID, or how things have been shut down due to the pandemic, the Social Security office, at least in the Texas area in Houston, is a disaster. And it has taken people 2 and 3 times just to get answers to their situation. So what we've got, this is your Medicare book, Medicare and You Handbook. It does not have all the answers. So I took the Medicare and You Handbook about 10 to 12 years ago and put it in people terms. And this is my book. It's called the Medicare Survival Guide. And it is available on my website, tonisays.com. And it makes everything specific. It's not in general. So we're going to go over some of the basics of it. Again, if you got questions, email us at info@tonisays.com. Or you can call us and we can answer your question on a personalized basis. Our direct number is 832-519-8664. And the 8664 stands for Toni. I'm Toni with an I and not a Y, because as you can tell, I am a girl. So this event is for educational purposes only. If anybody needs a specific consultation or wants to personalize a consultation to meet your needs, then we can do that. Okay. And there is a fee for consultations, but we can talk about that on a one-on-one basis. So let's get started. If you go to my website, you will see seniorresource.com. I now have a podcast, and seniorresource.com is where some of my articles are going. They have a lot of information on Medicare, dementia, Alzheimer's, what you need to do to make sure things are specific. It is a great website. So if you've got situations for yourself, your spouse, your mother, your father, and you're just confused on what you need to do, this is a great website and it takes care of everything. This is where my podcasts are, and we now have Medicare Moments podcast. So visit seniorresource.com if you want to see the podcast. And our office is in Sugar Land. And we can do Zoom meetings, because I'm sure somebody from Kentucky or North Carolina does not want to drive all the way to Sugar Land. So we can do Zoom or Google Meet, where we can help you customize your Medicare to meet your needs. Okay. And we're going to get started. We're going to talk about Medicare Part A, B, C, and D. There are no more parts to Medicare. So we're going to meet them all. And this is what your Medicare card looks like. Some people have no idea what a Medicare card looks like. And you can have different dates for Medicare Part A and Medicare Part B, depending on when you enroll. And we'll talk about that in just a few minutes. So here's your to-do list. And you will get what's called a Welcome to Medicare kit when you sign up for Medicare. And a lot of people do not realize that Medicare does not know how to enroll you in Medicare. They don't know the specifics. And Donna's now getting a lot of questions or rolling in. Hi, Donna.
And some of them are duplicates. So can I?
Here.
Okay.
So we're getting a lot of questions. Okay. We're getting a lot of questions. And I will answer them. All right. So as I said, Social Security does not know how, Medicare does not know how to enroll you in Medicare. Social Security does all of the enrolling. And whenever someone needs to enroll in Medicare, you need to go to the socialsecurity.gov website and open you up a My Social Security account. That does not mean that you have to sign up for Social Security, but you have to have a My Social Security account to get started. And that's very important. It's not easy to do it, okay? If you have a problem getting your My Social Security account started, let us know. We can help you because it's not easy. And this is Medicare's website, which is medicare.gov. And what they can help you with is filing claims, or they can help you with doing a prescription drug plan or enrolling in an Advantage plan. That is about it. All right. So we've got some questions, and most of them are going to be about retiring. And I will, I'm looking them over right now. Okay, here's a good question. This one is from Kathy, and she says, I'm turning 65 this year, but I will be employed and be covered by my employer group health insurance and contributing to an HSA. This is very important. Will I face penalties if I delay enrolling until I retire in 3 to 5 years? My employer benefits department recommends delaying Part B. We will talk about this because this is very important. I don't know how many of you have an HSA or you have group insurance. So I've got 7 people that have just raised their hand. If you've got an HSA, it's a whole different ballgame. If you have company insurance, that's another situation. So we will answer that question in just a minute. I've got another question from Mike. He says, I'm turning 65 in July. My wife is younger than me and covers us under her insurance, including prescription drugs through her company. What, if anything, do I need to sign up for Medicare? So I will answer Mike's question. Y'all can see how we need the questions. In enrolling is what confuses everybody. I got another one from Crystal that says, I'm planning to retire the month my husband qualifies for Medicare. So I have no idea when that is. You might want to let us know, Crystal, when that is. How early should he sign up? And aside from signing up for Medicare or the Medigap or Medicare supplement, are there other pitfalls? So what I need from Crystal is to find out when her husband is going to get on Medicare And what's her situation? Is she younger or older than him? Okay. And here's one from Daryl that says, my husband will not retire for several years. He has health insurance through his job. His birthday is April. So perhaps he only needs to sign up for Part A. Okay. So those are the kind of questions we're looking for. So if you've got specifics, let us know. So let's get started. And here's 3 ways to enroll. Number 1, we're turning 65 and receiving your Social Security check. Anybody who is turning 65 and you're already receiving your Social Security check, then you're going to get your Welcome to Medicare kit. And in it will be your card. We have tons of people that bring mail in the office, and they do not realize that this letter that they got from the Social Security office has their Medicare card in it. So if you are turning 65 and receiving your Social Security check, then poof, you're automatically going to get on Medicare. There are a lot of people who are already receiving their Social Security check, but they are on their spouse's group health insurance. If that's your situation, then you need to get with us, because some people don't realize that they can delay their Part B. And there's ways that you can do that if you're already receiving your Social Security check and you've got your Medicare card. We had a gentleman who signed up for Medicare. He was still working and he made a big mistake. He didn't need to do it. And so he ended up having serious health issues, and now he's got a serious problem. So we like to customize everything to meet your needs. Okay. Here's number 2 on enrolling in Medicare. Turning 65 and not receiving your Social Security check. That was me. I'm self-employed. I was turning 65 with an individual health insurance. So I had to go online. I had already opened up my Social Security account, and I enrolled in Medicare, got my Part A and Part B, because I had an individual health insurance. If I would have had group benefits, then I could have delayed enrolling in Part B for a later date. Okay, so let's see what questions we got. So again, we've got one that's from Anne in regards to her husband, Daryl. My husband will not retire for several years. He has health insurance through his job. His birthday is April of this year. He's going to turn 65. So perhaps he only needs to enroll in Part A. If Daryl is only on group health insurance and not on a HSA, like the first question that I had, which was Kathy, whose husband has an HSA. Anyone with an HSA does not want to enroll in Part A of Medicare, because as soon as you enroll in Part A of Medicare, you cannot fund your HSA. You can always come back at a later date and enroll, because you're working full-time with True Company Insurance. If someone has just a PPO or an HMO, just regular health insurance, not an HSA, then you can go online and enroll in Medicare Part A. And that starts your situation going. If someone does not enroll in Part A, that's fine. You've got company insurance that can protect you. Okay. You can wait till a later date to enroll. Some people are getting their Social Security check at 70. Guess what? That's when their Part A starts. So it all depends on what your situation is. Everybody's situation. You got any more questions?
Crystal's response.
Oh, this is Crystal's response. Says, my husband will qualify for Medicare in early 2025. I'm younger than him, and I will buy retiree health insurance through my former employee and will qualify for Medicare several years later. So Crystal's husband is not getting on Medicare. His Part A does not start until 2025. That's when he turns 65. So she's got some time, okay? I would suggest to Crystal, she might want to buy the Medicare Survival Guide. It's got all that information in there and help her out. But she's just getting prepared. She's got 2 years before he needs to enroll, okay? And I got another question. Let's see, what else we got? Here's one that's from Deborah. I'm retiring in March and losing my employer insurance. Okay. I don't know what Deborah's age is. I don't know whether she's turning 65 or if she's coming off her company insurance, but she's retiring March 31st. She wants her Medicare to start April 1st. I don't know when Deborah's birthday is, makes a big difference. But if she's somebody who is already past 65, this is where everybody gets confused. And she's still working and she's looking to retire. Then this is the form that I write about all the time. This is your CMS L564. This is the form that you get your employer to sign. And if you leave one job past 65 and go to another job, you've got to get all those employers to have this form. And this is what you turn into Social Security so you don't get the famous Part B penalty. You can raise your hand. How many of you guys are concerned about getting a penalty, the Part B penalty? I would think right now we've got about 58 people on here. I would think everybody would be concerned about that. This is the form that keeps you from getting the Part B penalty if you are working full-time with True Company Insurance. That's the key. So if you're still working, whether it's for an individual company, maybe you're working for the government, whoever, and you've got True Company Insurance. That was not my situation. I had an individual health plan, so I needed to enroll in Medicare. Big difference, okay? Don't wait if you have an individual plan. Get your Medicare kicked in the month that you turn 65. But this form right here is very important. And up at the top of the form, you want to always write special enrollment period. I had a lady who got a 2-year penalty. I'm looking at her form about 10 years ago. And we called Social Security and special enrollment period was not written up at the top. So I am talking to the Social Security office and the lady goes, is special enrollment period written in red up at the top? And I said, no, ma'am, it's not. They used to mail the forms to you and then you would fill them out, get the company to sign it and get it back to the Social Security office. Well, she says somebody from our office didn't do their job right. They should have written special enrollment period. There are 2 enrollment periods after January 1st. You've got general enrollment for people who never signed up for Medicare. And you have special enrollment period for people who are coming off their company insurance. And that is how I found out it had to be written at the top of the form and they liked it written in red. Well, in this day and time, we're faxing everything to the Social Security office due to COVID. So it doesn't matter whether you write it in red or you write it in black, but you want to make sure your form has special enrollment period written up at the top. We'll go over these forms at the very end. I'll let you know everything you got to have from Social Security. Okay? So Deborah, we need to know what your situation is. And I've got some more questions. This one's coming from Robert. He says, my wife and I are new to Medicare. My wife is diabetic and needs test strips and lancets to prick her finger. What part of Medicare covers diabetic supplies? We will talk about that when we get into the different parts of Medicare. Okay. So here's a question from Jeannie. And she says, does Medicare automatically enroll you before you turn 65? The only way that Medicare automatically enrolls you is if you're getting your Social Security check. That's it. If you're someone who's waiting to get your Social Security check and you're turning 65, then Medicare doesn't know that you're turning 65 because Social Security doesn't know that you turned 65. So the question is, does Medicare automatically enroll you? Only if you're getting your Social Security check. What you got, Donna?
I told her to call us as soon as the webinar is over.
Oh, so this is somebody coming from Del Rio. And it says, I turned 65 in January. I currently do not have health insurance and I am really healthy and I self-pay. Do I have to enroll in Medicare? Well, yes, I wouldn't say you have to. You know, it doesn't make any sense. Medicare is voluntary. You don't have to enroll in Part B and you don't have to enroll in Part D. But if you don't have any health insurance, you know, and you go and enroll at a later date, then you're going to get the famous Part B penalty. So, Angela, I would advise you to enroll because you are in what's called your initial enrollment period. This is a great question for right here. And this is for someone who's turning 65, not anybody who's past 65 in 90 days. So Angela can enroll 3 months before she turned 65. Hers was in January. The month she turned 65, which is January, and 90 days after. So it's February, March, and April. If Angela waits past April to enroll in Medicare, then she's going to get a penalty and she is not going to be a happy camper. So if I were you, Angela, give us a call, 832-519-8664, and we can help you with that. So y'all can see how confusing this can be. If you're not working full-time with True Company Insurance, that's the key. I just got an email from someone who said that they were in Canada working for a company in Canada, and now they're coming back to the States and they want to get on Medicare. I don't know how long it's been that they've been off their company insurance. I don't know the whole specifics, but when that person turned 65 in Canada, they should have enrolled in Medicare Part A and Part B. Until I get his specifics, I don't know what his situation is. Okay. So you can see this can be awful, awful, awful confusing. Here's a question from St. Louis, and it says, my wife does not have enough quarters to qualify for Medicare. They've been married 38 years. He's worked. What do we do? So, Henry, I would suggest that you call us so we can do a consultation with you, because you're going to have to get your marriage license to the Social Security office. I'm not sure when your wife is turning 65 or if she's coming off your company insurance. But for anyone who hasn't worked 10 years or 40 quarters, that's the good thing about getting married. You can get on their Medicare. Okay? So are you confused? If you're confused, say yes. We got a few confused people. The hands are going up. Okay. I really like doing workshops where I'm on a face-to-face with people, live workshops, but those kind of ended with COVID. So now we only do Zooms. So let's go through the different parts of Medicare. And this is original Medicare. This is your red, white, and blue card. You got Medicare Part A, you have Medicare Part B. There's only two parts to original Medicare. And with original Medicare, you have to work 10 years or 40 quarters to get Part A at no cost. In Texas, the TRS teachers are not paying into the Social Security system. So a lot of them do not have the 40 quarters. Henry's wife does not have enough quarters. So she will have to get on her husband's Medicare. And that's where you have to take your certified marriage license to the Social Security office to sign up for Medicare Part A and Part B. It can be confusing. So Part A started, Medicare started July 30th, 1965, and the maximum cost was $40 once a year, and the premium for Part B was $3. Well, we've come a long way. Now the cost is $1,600, not once a year for Part A, but 6 times. And it's a 60-day benefit. It recycles itself. You have an inpatient hospital stay. It covers the 100 days of skilled nursing. We'll go over all this in just a minute. Covers hospice and home health. Part A is where your tax dollars are coming. Okay. Part B is your lifeline. This is what's so important. And the average person is going to pay $164.90 for this year. The deductible for Part B is $226 once a year. So my out-of-pocket on my Medicare is $226. Medicare is going to pick up 80%, and you have to pay 20% if all you have is your card. And Part B covers everything: your wheelchairs, your walkers, your doctor going to the doctor, your doctor having surgery, your MRI, your CAT scan, your sonogram, the diabetic supplies that one of these people were talking about, where the diabetic supplies paid for. Whenever you're getting your diabetic supplies, which is the medical equipment, you want to make sure that you're working with a certified durable medical equipment company, someone that Medicare has approved. If Medicare hasn't approved that company and you're buying your equipment from them, then you're going to pay 100% out of your pocket. So Part B covers outpatient care, and most people go in the hospital as an outpatient, and you have to be in there for a certain amount of days, and then you're finally considered an inpatient. But everything starts out as an outpatient. I know it gets confusing. I don't know who comes up with the rules, but they need to make it simple for everybody. And here's your premiums. So they raised the numbers this year. That's one good thing. So anybody that is an individual, you're not married, if your income is $97,000 or lower, or if you are a couple, husband and wife, and your income is $194,000 or lower, then your Part B will be $164.90. We will go over all these numbers at the end, because a lot of people retire and they're making more money. And you find out you've got to pay more. Well, we're going to talk at the end on how to bring those numbers down when we talk about Social Security. Does that sound good for you guys? I hope so. Okay. So don't get too caught up on this right here. To have all your numbers picked up, to have all your costs picked up on Medicare, original Medicare is a Medicare supplement. Here comes Donna. Now we got more questions, huh, Donna?
Yeah. Some good questions.
We got some good questions.
Yeah.
Okay. So a Medicare supplement works with original Medicare. If you're someone who's traveling through the country, or maybe you've got certain health issues and you want to be able to pick what hospital and doctor you want to go to, a Medicare supplement with original Medicare is your best way to go. It's a good way to go. So what you got is you have the freedom to pick and choose. You've got Medicare Part A and B. When you enroll at the right time, that's why I just wrote an article about Part B being like gold. You want to make sure that you're getting Part B at the right time, because Medicare will give you a 6-month window that you can get any Medicare supplement without having to answer one health question. And we see all sorts of problems coming in the office. So your original Medicare, the Medicare supplement works only with original Medicare, works only with your red, white, and blue card. You cannot have a Medicare supplement and a Medicare Advantage plan at the same time. That doesn't work. You can only have a Medicare supplement with original Medicare, and then we will discuss a Medicare Advantage plan in just a few minutes. The downside to a Medicare supplement is that the price goes up each year. You get a rate increase. Like you get a rate increase on your car insurance or your homeowner's insurance. You get a little rate increase each year. They do not have a prescription drug plan, so you got to get a separate prescription drug plan. And you want to get a Part D plan so you don't get the Part D penalties. Nobody wants a penalty, okay? And here's how it works. You have a 6-month window that when you first get on Part B, or you first sign up for Medicare Part A and Part B when you're turning 65, that you can get any Medicare supplement without having to answer one health question. And that's very, very, very important, okay? So here are the different Medicare supplements. And right now, Plan G is probably one of the top plans there is. Anybody whose Part A started prior to January 1st, 2020, you can get Plan F. They're slowly but surely trying to fade Plan F out. But anybody whose Part A started after January 1st, we can only get a Plan G. And the difference between a Plan G and a Plan F is your Part B deductible of $226 for this year. Next year, it could be a different out-of-pocket, which could be $240. Last year, the rates were a little higher and they came back and gave us a discount. So here, you can go to any hospital and doctor nationwide. There is no network. You don't have to worry about the doctors accepting it, because if your doctor is accepting original Medicare, then they file the claim with original Medicare and things will get paid. It's very simple. So let's see what questions we have. We have a question from Judy, and she says, I'm 64 and receiving Social Security. I am on VA healthcare. Do I need Medicare? That's important. We advise everybody to get Medicare Part A and B. People that use the VA do not have to have Part B for the VA to pay. But if Judy ends up wanting to go to MD Anderson, or she wants to go to another facility that's outside the VA, if she doesn't have Part B, she'll pay 100% out of her pocket. So Judy, if you want to call us and set up an appointment, we can help you customize it. Here's our number right here, but I advise everyone to get Part B. That's because you never know when you need to go outside the facility, and the VA is good. So here's Deborah is asking a question, and it says, how long does it take to get Medicare started? I'm 70. Both my husband and I are covered under my group health insurance. I got my employer benefits office to fill out the form already. So what does she do now? So we will go through that at the end when I talk about Social Security. There's 2 forms you've got to have, the L564 and the CMS 40B. So we'll talk about that. Those are the forms that Deborah's going to want to have to get to the Social Security office. It all depends on when you're coming off your company insurance. Okay. Let's see what else we got here. See what other questions. I've got a question from Gail, and Gail's questions I'm going to get at the end when we're talking about the forms on Social Security. So Gail, I will answer your question. And I've got a question here from Kathy, and it says, in simple states, what do we do? Her husband is still working. She's a retired Texas school teacher. So she doesn't have credits enough, the 10 years or 40 quarters. Both have been under full health benefits through her husband's job. Okay. So I'm not sure how old her husband is. Let's see. He's going to retire when he's at 66. So when he retires, she's going to have to get the forms and get the company to sign it. But Kathy will have to take her marriage license down to the Social Security office to sign up so she doesn't get a penalty. What's really sad is they charge you for Part A if you don't have enough quarters. But if you're married, your spouse, you can get on your spouse's Medicare. And that's what she's going to want to do. It depends on when she needs it. So Kathy, if you want to, you can email us because yours is a little specific. Okay, here's Medicare Advantage plans. That's all the advertising that you see. There's 4 types of plans. You got an HMO and a PPO. You don't see as much of the private fee-for-service or the special needs plans. You want to make sure that when you're getting on Medicare, talk to your doctor. Find out what plans they like the best. They know their Medicare. They know your health issues the best. We can always go to a Medicare Advantage plan. That's what happens between October 15th through December 7th. There are no health questions. So if you decide you want to go with an Advantage plan, you can just automatically do it. So with the Medicare Advantage plan, it covers all the benefits provided by Medicare Part A and B, but you've got some cost. You've got Part A and Part B. You have deductibles and copays that you have to pay. You've got to go by their rules. Here in Houston, here comes Donna. She's got more questions.
Another good one.
Here in Houston, we have what's called Kelsey-Seybold. Kelsey-Seybold only does their Medicare Advantage plan. That's it. They don't use original Medicare. So people have to sit down and look at it because some people move out of their area. Some people get in their RV and start traveling. So you want to customize this to meet your needs, not to meet the telemarketers that are calling you. So with a Medicare Advantage plan, you really want to stay in their network because if you go out of network, you could have to pay more. You don't use your red, white, and blue card. You put your Medicare card away and you use that Advantage Plans card. And you have to obey their rules. You got to go to what hospitals they tell you to go to, what skilled nursing they tell you to go to, where to go for physical therapy, the whole 9 yards. You don't pick. They pick for you, okay? And you don't lose your Medicare, you just don't use it. So you put your Medicare card away and you use that insurance company's card because Medicare pays those Advantage Plan companies a nice amount of money. So sit down, with your kids, sit down with your doctor, sit down and look at what is your best situation because there are no do-overs with Medicare, okay? And here's what confuses everybody the most. Medicare Part D, the prescription drug plan, okay? Because you can raise your hand. How many of you guys want to get in the donut hole? Does everybody want the donut hole? We got the hands are going up. People get confused. When you get in the donut hole, you know it. Okay? So what happens is there's 2 different ways that you can get a prescription drug plan. Stand alone with a Medicare supplement or stand alone by itself or with a Medicare Advantage plan. There's 2 different ways. They all have deductibles, copays, and the donut hole. The only group that I really know of that doesn't have the donut hole is the TRS, the teacher retirement system. They have a decent prescription drug plan, okay? If you've got a lot of prescriptions. And you have to enroll at the right time. You don't want to go past your window or you'll get a penalty. Anybody that's coming off your company insurance, even if whenever you're coming off your company insurance, you have 60 days that you can get a Part D plan without a penalty. And the penalty will go all the way back to the day that your Part A started. So, you just say, if you're not taking any prescriptions and you say, well, I don't need it, I'll get it later on. The penalty could be $20, $30, $40 a month on top of the cost of the prescription drug plan, depending on when your Part A started. So it can get confusing. All right. So what happens is when you get in the donut hole this year, we have a $505 deductible. And once the true cost of your drugs grows to $4,460, then you get in the donut hole and you have to spend a total of $7,400 to get out of it and to get into what they call catastrophic coverage. So if you can see here, Advair is $397, or Humulin is over $6,000 now. So when you buy Humulin, and a lot of people use Humulin or Humira, when you buy Humira, you automatically get in the donut hole. And when you have to go pay for it, you pay $1,700. And then when you get in the donut hole, you'll pay $1,300. So when someone gets in the donut hole, they know it. This year and last year, diabetics got a relief because now Novolog, all the diabetic meds are either getting a $35 copay even through the donut hole. So that's important. And you can see it can really bring you down. So when someone comes in the office for a consultation, we focus on the prescription drugs, then we'll focus on what your health issues are. But this is the most important thing right here, okay? So when you get in the donut hole, you pay 25% of that brand name drug. The drug company, Pfizer, Lilly, Moderna, whoever, pays 70%, and the Part D plan pays a 5%. So all this comes up to 100%. What's amazing is we don't have the mafia anymore. Okay, we now have big pharma, and they're controlling everything, and they're costing a fortune. What used to be affordable is now expensive. So, focus on your prescription drugs. Every year this changes. And from what I understand, in 2025, the donut hole is supposed to go to $2,000. So we'll have to see how that is maximum out of pocket, how that goes. But it hasn't happened yet. So let's see what happens. So you want to make sure that all of your brand name drugs are covered under your plan. And there are different ways that you can get help on prescription drugs. Some people's prescription drug plans are $14,000 a month for that one cancer med. So you want to make sure that you're doing what's best for you. Okay. So if we have any questions on prescription drugs, y'all can send them and Donna will bring it in here. Someone's asking, Robert is asking, what is the average annual increase in a Medicare supplement plan? Right now they're changing. A lot of companies are charging 10%. Some are charging 9% on a Medicare supplement as an increase. Each year it's different, so I can't tell you. Okay. Let's see what questions we got. So Barbara has asked, why should I get a supplement instead of an Advantage plan? What is the donut hole? Well, I've already explained how the donut hole works. I can't tell you which plan is best for you. You need to sit down with your doctor and find out what plan best meets your needs. What you've got with a Medicare supplement is you have more freedom to go to your hospital and doctors, depending on what your health situation is. With an Advantage plan, they're good, but everybody's looking at the zero copays or the zero premium, and they miss what the maximum out of pocket is. Some of them it's $11,000, some of them it's $6,000. If you're someone who's using a big cancer center, you might want to talk to them and find out what best meets your needs. That's something I can't say. We have to do a consultation to do that. So what you got, here's the cost. So if someone's income is down here, I'm going to show you in a few minutes how to bring it down, how to lower it if you're not working anymore. But the average person for this year is $97,000 as an individual or $194,000 as a couple. If you're still working and you're on Medicare and your income is higher, then you're going to pay more. Some people have to pay more. I'm self-employed. I have to pay more. So it just depends. And then if your Medicare has 3 family members and 2 girlfriends. The 3 family members are the IRS, Social Security, and Medicare. The IRS tells Social Security and Medicare everything on you. The two girlfriends are Maggie, which is modified adjusted gross income. That's what's right here. Or IRMA, your income related monthly adjusted amount. So if your income is anywhere from 194 to 246,000, then you have to pay more for your Part B and also for your Part D. This is IRMA. Does that make sense? I hope so. So here's what we got. We've got the changes for 2023 as far as Social Security is concerned. And what happened this year, we had a good year. Now the cost of living adjustment went up by 8.7%. So everybody got a big raise. 2019, it was 1.6%. 2020, the increase was 1.3. 2021, it was 5.9. This year, it's 8.7. They increase it every October. I can't tell you what it's going to be until next October when they finally release it. And what's happened, this is what people don't understand. Let's just say you want to go ahead and get your Social Security check, but you're still working. If you are before what they call the FRA, which is your full retirement age, if it's before that, you can only make $21,000, $21,240. And you're going to have to, if you make more, now you go back to work and you're making more money, then you've got to pay $1 for every $2 over that amount. And if you're at your full retirement age, which mine was 66. So if you're at your full retirement age, then for this year, you can only earn $56,520. If you're making more than that, then you have to pay $1 for every $3 of earnings above that limit. You know, make sure that you are at what they call your full retirement age. Most people in 1958, your full retirement age is 66 and I think 6 months or 8 months. After 66 and 8 months, you can earn as much as you like. I can earn as much as I want and still get my Social Security check. So that's important. That's very important. And if you're someone who's leaving work, this is the form you want to have all of your employers after you turn 65 to sign it. So if you're leaving a job and going to work for somebody else and you're 65 and 5 months, get your employer to sign the CMSL 564. You can download this off of the Social Security website, or you can email us and we can send you the form. It's a request for employment information. And then when you go to sign up and get Part B, you have to use this application. And if you do not have a Medicare number yet, you haven't signed up for Part A, you don't know what your Medicare number is, you need to go online, go to the Social Security website, and sign up for Part A. So you have a number to put here. And do you wish to sign up for Part B? Yes. And you put your name. And what's so funny is in the directions, it does not tell you that under remarks is where you put what month you want your Part B to start. So if you're retiring in April and your company benefits are leaving May 1st and you want your Part B to start May 1st, then under remarks, you have Part B start May 1st, 2023. You can't leave this blank or they're not going to file it. And most of the Social Security offices either want you to fax it to them or they want you to put it in their little drop box. A lot of them, depending on what part of the country you're in, they will not see you on a face-to-face meeting until you call them and set up that time. Here comes Donna. Wait, what else you got?
Another good question.
Another good question. Okay. So that's very important, especially the remarks. Make sure and always make a copy. We have people that drop their original paperwork off and don't make a copy. Make a copy of everything. And if Social Security has told you something, get them to put it in writing. That's important. You've got to protect yourself. And then we've got the premiums. Here's your premium. So we had a gentleman who came in our office. He retired from Wells Fargo. He was a commercial lender. He made over $900,000. But now he's only on his Social Security check. So we helped him bring his premium. He got a bill saying he owed over $560 for Part B, but he also owned the extra for Part D. Okay. But now he's not working. What you have to decide is, do you want to wait 2 years for the IRS to notify Social Security that you are no longer working, or do you want to tell them? And most people say, yeah, I'd rather tell them right now. So this is the form that you use. It's called the life-changing event form. It is the SSA 44. And you take this form to the Social Security office. You file one for the husband, one for the wife. And that brings your income down. That lets them know that you are no longer working, or maybe someone passed away, or you got a divorce, or whatever your situation is. But this is very, very, very important. And these are the good Social Security information that you don't get anywhere. So, so someone is asking a question. This is Daniel. And it says, how do we get a copy of the presentation that you're going through right now? As soon as Zoom downloads this, we will be emailing everybody this presentation because it's hard to remember it. Okay. But everybody will get the presentation probably Friday or Monday, as soon as Zoom downloads it. And here's a question from Donna that said, I retired in November of 2022 and my Part B premium was, or she thought it was going to be $164.90. Social Security is now telling her that she's going to have to pay double due to her tax return. They go back by 2 years. So 2022, they went back to 2020. 2023, they go back to 2021. I forgot to say that whenever you're filing your SSA 44 form, they go back to the last time that you filed your taxes. And so she's now having to pay double. When will my monthly premium be reduced? Well, Donna can go and file this life-changing event form, depending on what her income is right now. Some people's income never changes. Some people are blessed to have a lot of money coming in, but some people are only on their Social Security check, or maybe they're pulling their money off of their 401k or whatever. So you've got to itemize what you're making. I had a couple come in this week. They were making $300,000. Now they're only making 120 because they retired. Well, the 120 is under the 194. So they can go back and file the SSA 44 form, and Social Security will bring the premium down. So it's very important. It gets real tedious. And if you end up having a problem with the Social Security office, that's what your congressman is for. Get your congressman to help you file these forms. That's what they get paid for. That's where our tax dollars are going. Let's see. So I got a question from Tracy. It says your explanation of 2023 SS changes and the penalty when reaching didn't make sense. If not, starting Social Security payments before you're fully retiring and not working again, is there any loss of Social Security funds expected? So if I go back to what you were talking about, the FRA, if you're still working and you're before the your full retirement amount, which right now it's 66 and 8 months, that's what your full retirement amount is. That's where you can earn as much as you want. Then you can earn as much as you want and not have to pay extra. But before that, when you're at your full retirement age, you can only earn $56,000. So I know it gets a little confusing, but that's kind of how that works. If you have any other questions, Tracy, just email me. So someone asked, are earnings thresholds under Social Security discussed for individuals only or couples? So the individual is 97,000, the couple is 194. So couples can make more than the individual can. I hope that answers your question, Robert. And here's a question from Gail. It says, how does Medicare calculate your costs when you retire and enroll in Medicare? They go by what your income was 2 years ago. So in 2023, they're looking at 2021. 2024, they're looking at what your taxes were in 2022. If you're not making that kind of money, then that's where you file the life-changing event form. Should you wait if you have an opportunity to decrease your paycheck? I mean, it just depends. Does Medicare use a bracket to figure out how much your premiums are going to be? And that's yes, that's these amounts right here. And every year these change. They went up this year. That's a good thing. How many years do they use your tax returns? They go back by 2 years. And does Medicare adjust your premiums every year? Yes, you keep filing the form until your income finally levels out to here or whatever your lowest amount's going to be. Now, if someone goes and sells their, maybe they have a apartment complex and they sell it, or they're starting to draw a lot of money out of their 401k and the amount goes up, then there's nothing you can do about that. You're just going to have to work through it. Okay, it gets confusing. You've really got to customize and tailor this to meet your needs. And some people sit down and they start talking to all their friends. Well, their friends can confuse them. So we've got the articles. They're all in the Medicare Survival Guide. It kind of explains it on a one-on-one basis. Now, here's your Medicare annual enrollment period. It's from October 15th through December 7th. That's what we just got finished with. And that's where you can sign up for a Medicare Advantage plan, or you can sign up for a prescription drug plan. I look at my prescriptions every year. And let me tell you something, after January 1st of this year, they're already starting to change the cost of some prescription drugs. So don't think the numbers are going to stay the same for the rest of the year. They can change. The Part D plans can change the cost of the prescriptions at any time. So don't be surprised. You know, if you have a problem, then email us at info@tonisays.com or call me 832-519-8664. And like I said, visit seniorresource.com. There is a lot of information. There's financial planners. I am not a financial planner. I'm a Medicare planner. There are people on there that talk about dementia and Alzheimer's, elder care issues, legal situations. And we've got the podcast that's on seniorresource.com. So if there's any more questions, do we have any more questions or anything else that you need me to go over? You got one more? Okay, so Donna is sending a question this way. We got a little system going here. But you just have to personalize this. You want to make it meet your needs. And we always tell everyone to sit down and talk with their doctor or talk with their office manager, because they understand your health situation more than your friends do.
I just want a clarification. That's something.
Okay. So this is coming from Daryl, and he said, when does the employer fill out the special enrollment period form? When the employee quits? So when do you fill out your CMS L564? When you're leaving your work. Don't. You leave one work, you go to work for another company. If you're leaving that company to go to work for another company, hold the form. And then get another form from the other from the company that the future company that you're going to leave. All right. A lot of people have worked for a company and now they've gone to work for a new company. They've been there for 5 years, but they forgot to get the other company to sign the form. You'll get a penalty. You want to make sure each company that you've worked for after you turn 65 fills out a form, and hold it, because you have to turn them in. You don't have to, but it's nice to turn them in. So that would be what I would say. Okay, so if anyone, has any questions, we have newsletters. You can go to the Toni Says website, fill out for the newsletter. Whenever you sign up for the Toni Says newsletter, we have a prescription drug survival guide that walks through the donut hole and everything. So go online, sign up for the newsletter. You'll get the free prescription drug survival guide. And that's it. That's all I can say. So if you've got any other questions or you need something to help you navigate the maze of Medicare, either give us a call or you can email us at info@tonisays.com. And let me tell you something. It doesn't matter if you're in Texas or New York or North Carolina or California. Medicare is federal. It affects everybody the same way. All right. So thank y'all for being here. Again, if you've got any questions, just send them our way, and y'all go have a nice day. And we have beautiful weather here. So get out and have a good time. I appreciate it. Thank you for being here, and we'll talk with you later.